Hey guys, Rick from the Motivated Paramedic channel. And if you haven't subscribed, click the little bell click the little bell for notifications and subscribe. The Motivated Paramedic. This week we got a few new sponsors. If you'll check the little bio below on my channel, we got everything from AR 500 armor, survival nutrient for some disaster prepper hunting food. We have Mountain Medical. We have Black Angel Medical as well. All of these are excellent sources, and they're trying to help me grow my channel where I can do more for you guys, whether that be equipment, travel to other EMS agencies to interview people, anything that you could think of. But this week, I'd really like to talk about EMS education and where we're going from here. So those of you on social media, those of you kind of in the business, modern day, post-COVID, we hear a lot of people talk about, well, I want to be paid as much as a nurse. I want to be paid like a nurse. I have autonomy in my position. I have a very large scope of practice. National Registry scope of practice is quite large. Now, obviously, every state has their own little tweak on that, but as a scope of practice, as a National Registry paramedic, that's very large. So I think that if people say, I want to be paid like a nurse, we are probably going to have to transition to a 2-year program as a standard. Now, I know what people are going to say, well, I'm a certificate paramedic and it doesn't make me any better to have a degree. I understand that there's very limited data on being a degreed paramedic or a certificate paramedic changing outcomes of patients. I would agree with you. There's very limited data on a 2-year nurse to a 4-year nurse. The data I could find was you had limited data on that, but the data I could find was 4-year nurses had less medical errors than 2-year nurses, but it didn't look at mortality and morbidity. There's limited data to show that. But I think that if we want to be paid more, we're going to have to draw a line in the sand and say we need to have a 2-year degree by this date and this time, or however we want to say it. Those of you who are unaware, I posted a couple months ago about a draft proposal from EMS.gov, the federal EMS kind of board looking for the future, that they had submitted a draft plan as a master level practitioner as a paramedic, called a paramedic practitioner. And many people took that as, well, we're already short paramedics and you're going to make it a master level. No, this is a career step ladder where we have a 2-year degree, a 4-year degree, a master's level degree, and who knows, maybe in the future there's a doctorate level. But I am a certificate paramedic. I received my paramedic certificate in 2001, took my National Registry test, became state certified, and now practice in the state of Alabama. But when we start talking about I want to be paid like a nurse, there's very few, if any, programs I could find nationwide that still allow what they used to call vocational nurses or technical nurses. Those are pretty much have gone by the wayside. Now, every once in a while you might hear vocational nurse, but it's really an LPN program. But there's very few places you'll find an RN program that is not a 2-year degree. There is a few bridge programs. We have some in Alabama that you have to be an LPN or a paramedic with some preliminary college degree or courses, and you can bridge into an RN program. But again, you did have to have some college level biology, English, math, psych, sciences, things like that. So if we want to be paid as a nurse, I think that we're going to have a 2-year degree. And I know what everyone's going to say, well, we're short, we can't afford to add that extra time. Well, when we actually look at how much time extra there is, we're talking normally a semester or 2. So here's what's really funny. I went to paramedic school, started in 2000, graduated in 2001, June of 2001. It was a 3-semester program. I now live in northern Alabama, and our local community colleges, there's 3 of them within an hour driving distance, that all have a 3-semester paramedic program. So in 22 years of me practicing as a paramedic, the amount of knowledge has increased dramatically, from rapid sequence intubation to basic anatomy that has improved to the overall kind of preparatory knowledge in A&P and cardiology, pharmacology. Guess what? It's still 3 semesters. So we're still squeezing all of that time into 3 semesters. Yes, there's plenty of colleges that offer a 2-year degree in paramedicine, but the only states I could find, and if I am wrong, please send me a message, a DM. I'm going to go live in the future as soon as I can get this mobile feature up and running. I apologize. Is Oregon and Kentucky. I read EMS rules for Kentucky was the school you go to has to be able to confer or give a degree prior to your paramedic licensure in the state of Kentucky. So if I'm off on those specifics, please send me. If you're from Kentucky, we want to have you on. We'll gladly do an interview. Tell us how it works in Kentucky or Oregon. But as a whole, that's not true. Certificate-based programs are the way that most of the country work on. Now, you can get a 2-year degree, but we know that that does not change our pay in most cases. Now, there are some agencies, especially tax-funded fire departments, EMS agencies that are county-based, state-based, that may pay more if you get a 2-year degree. Now, maybe that's because of a city policy or a county policy or a state policy. But if we're talking private industry, there's no reimbursement difference between a 2-year degree and a certificate-based paramedic. So we know that this is just a step in the direction. We still have to work on reimbursement at the Medicare level. We know Medicaid at the state level is substantially lower reimbursement. I understand that. But I know that when people instantly say, well, it doesn't change my pay any, why should I do it? Well, if we want to have the pay like a nurse, be treated like a professional in the same capacity, when people say, well, I get treated like an ambulance driver, I get treated like I just move patients from A to B. And I'm not saying a degree is going to change all that overnight, but it's showing that we're in the same community or in the same realm as these other allied professionals, that it's required to have a degree. You know, when you start looking at other countries where to be a base paramedic, Australia, England, Germany, most of them are teetering on a 3 to 4 year degree program. And the first 2 years are more like a first 2 years at a preparatory college level, 100, 200 classes, your English, your math, your anatomies, your things of that nature. And your third and fourth year are your actual paramedic programs. So this isn't unusual worldwide. Again, that's the point of this channel, is to travel to these places and give you guys more insight. So again, use my sponsors, help me make a little extra. We'll travel more, we'll get some better equipment, we'll have some more people on. If you guys have a medical director or you're a senior leadership and you want to be on, please drop me a message, rick@prioritymedicaltraining.com, or you can send me a message on YouTube. I'm on Instagram as well. So please track us down. So we understand that the pay doesn't change right now. That's something we need to work on. If you're not involved with your state House of Representative, your state senator, your federal House, or your federal senator, now's the time to get involved. And I'm not saying you got to beat the doors down, but drop an email. Maybe someone in your family knows them. Maybe you saw them at an event and you could touch base with them. All these things, we have to start the ball rolling at a ground roots level. We found out during COVID, of all the things that we told the public and our leadership that we could do for years, well, we got to do it. We were shown that we could really push a lot of patients. We could manage these patients. We could triage patients in some parts of the country where the paramedic went out almost like a community paramedicine and said, you don't need to go to the hospital. Yes, you're COVID positive. We can treat you at home, and we're not going to take you to the hospital. Well, that's a version of a community paramedicine. And don't forget, not all community healthcare has to be a paramedic. I'm not saying that. National Registry put out some data not too long ago that over 40% were EMT based. So please don't think that you have to be a paramedic to perform community paramedicine or community EMS. But back to what we're talking about. If you want to get paid more, you probably need to go back to school. And again, I am a certificate paramedic. Yes, I went and got my bachelor's. Yes, I have my master's. And yes, I'm working on my doctorate. But that is for myself. I don't expect to get paid more. Should the profession be growing? Absolutely. I want to be an advocate for the profession growing into being not a technical, but a professional, where we are in line with nursing. We have a place to go. We have a ladder to grow. Now, again, that starts with reimbursement changes, of course. It starts with the federal understanding. If you look at the EMS.gov draft, where it talks about a paramedic practitioner, it asks for a nomenclature change, a name change of a paramedic to a paramedic practitioner when we get at the level of a master's degree, and they're aligning us with a physician assistant and or a nurse practitioner, but in the EMS world. So there's people thinking the same thing, and we are growing that way, but it will help dramatically when we make a decision collectively. And I know people are going to say, well, my state's never going to go for it. I understand. But if we want to get paid like a nurse, and we want to complain that we're never paid enough, we have to start somewhere. Now, there's other avenues. We know we got to start with people understanding what we do for a living. A lot of that's public ed. When you look at England, for example, they have posters up everywhere that say, this is a taxi, this is an ambulance, this one's for emergencies, this one's not. So we have to recondition the public into what's an emergency, what's not, and some agencies in the U.S. are setting up non-emergency phone numbers to speak to a nurse on the phone to say, hey, this is the symptoms I have, this is the collection of injuries I may have that are minor, what do you think I should do? They may give some advice over the phone, they may tell them to go to an urgent care, and they may say, hey, follow up with your physician. And if they think it's something serious, they'll arrange an ambulance to come out, maybe community paramedicine or a BLS ambulance, to assess the situation. So we know this is a huge ball to unwind, but today I want to talk about again and reiterate that if we want to be we want to be paid like a nurse, we probably need to get a degree. And I know this is going to ruffle some feathers, and I understand, but guess what? It needs to be done. It needs to happen sooner than later. And the chance that this growing and getting the profession closer to what we want and what we feel we need and the respect we want to gain, this has to do with that. And I know what people are going to say is, we're short paramedics already, we just don't have the time. Well, when you look at a lot of areas of the country, they live in an EMS desert. And yes, I understand that those EMS deserts are huge and wide, especially when you get in the middle part of the country, where super rural, ultra rural, they're going to have a hard time keeping EMS even afloat in many of those cases. And you can Google almost once every other week that there's an ambulance service that's closing due to lack of funding, lack of reimbursement, lack of volunteering, all those things. I understand that, but we've got to work at different parts of this ball together. Some of this is pay increase through greater reimbursement at the federal level. Some of this is county-based reimbursement, state-based reimbursement for Medicaid. Again, it may make people mad, but I really think that we need to progress to a 2-year degree relatively soon, and all of us need to be working on letting our elected officials know what we do. And there's 13 states, I think is the last count, where EMS is now considered essential. That's 13 out of 50. I live in Alabama. Alabama is one of them. Started last year in Alabama. But no one can really tell me what essential means. Does that mean when there's a pandemic, we have to go to work? Well, we went to work anyway, so I guess we were essential the whole time. Or does essential mean there's funding? Does essential mean that nobody really knows what that means? I've actually asked a House representative in the state of Alabama to do some research for me, because they were not aware what essential meant compared to what we were before we were essential. So is this just something on a piece of paper? Is this something other states need to do? There is lots of state funding that's starting to be kind of churned up, at least in the draft setting, where they're pushing out more money to EMS that never used to be there before, because EMS, again, reimbursements are small. You can't live off reimbursements unless you're very good at billing and payables and understanding how the process works. And there's lots of EMS departments that are just closing up, whether volunteer, private, public. Here in Alabama, there's multiple private services, there's multiple public services, there's hospital-based services. We have a full collection of, including a not-for-profit ambulance service that's pretty large. So we have lots of models. Which models work, which models are long-lasting, which models have a legacy to them. That's, to be seen in 10 years. Where do we land next? But again, Rick from the Motivated Paramedic, leave a comment if your feathers are ruffled, not trying to cause trouble. I just think it's important that we deal with this up front and start to change what we're doing for the better of the profession long term. I try to keep these under 20 to 15 minutes because we know our ADD, and most of us, we just can't watch for anything longer than that. I hope you guys have a great day. Be very careful. Be safe. Take care of your family. Take care of yourself. And again, hit my sponsors up. Leave some good comments. Ask a question. If you guys want to be on, we'll do a joint video Zoom type call, and we'll see what we can talk about. Again, if anybody's from a state that mandates a degree that I didn't mention, please let me know. Or if you're in an agency that or a state that's essential and you've been told what that means, again, love to see you. Hope you have a great day.